A hysterectomy is a surgical procedure that involves the removal of the uterus, the organ where a fetus grows during pregnancy. It is one of the most common gynecological surgeries performed worldwide and can be carried out using various techniques depending on the underlying medical condition, patient's health, and other relevant factors. This video delves into the types of hysterectomy, indications for the procedure, and the recovery process. Types of hysterectomy. Total hysterectomy. In this procedure, the entire uterus, including the cervix, is removed. It is the most common type of hysterectomy and is performed for a wide range of conditions such as uterine fibroids, endometriosis, adenomyosis, and certain cases of cancer. Partial hysterectomy, supracervical hysterectomy. In this type, only the upper part of the uterus is removed, leaving the cervix intact. This is generally chosen in cases where the cervix is healthy and there is no need for its removal. Radical hysterectomy. This is a more extensive procedure often done to treat gynecological cancers, particularly cervical or uterine cancer. It involves the removal of the uterus, cervix, the upper part of the vagina, and sometimes nearby lymph nodes. Hysterectomy with bilateral salpingo-oophorectomy. This involves the removal of both ovaries and fallopian tubes along with the uterus. It might be recommended in cases of ovarian cancer, high risk of ovarian cancer, or severe endometriosis. Indications for hysterectomy. Hysterectomy may be recommended for a variety of medical reasons, including uterine fibroids. These are non-cancerous growths in the uterus that can cause heavy bleeding, pain, and other discomforts. Endometriosis. This condition involves the tissue lining the uterus growing outside it, leading to pain, infertility, and other complications. Adenomyosis. Similar to endometriosis, this condition involves the tissue lining the uterus growing into the muscular wall of the uterus, causing pain and heavy bleeding. Uterine prolapse. When the uterus descends into the vaginal canal due to weak pelvic floor muscles, it might require surgical intervention. Gynecological cancers. Hysterectomy is often performed to treat cancers of the uterus, cervix, or ovaries. Chronic pelvic pain. When other treatments have failed to alleviate severe pelvic pain, hysterectomy might be considered. Uncontrollable uterine bleeding. If heavy and prolonged bleeding cannot be managed with other treatments, hysterectomy might be necessary. Recovery from hysterectomy. Recovery from a hysterectomy depends on the type of surgery performed and the patient's overall health. Here is a general outline of the recovery process. Hospital stay. The length of hospital stay varies but is usually a few days. In minimally invasive procedures, like laparoscopic or robotic-assisted hysterectomy, the stay might be shorter. Pain management. Pain and discomfort are common after surgery. Pain medication and other techniques are employed to manage this discomfort. Physical activity. Patients are usually encouraged to engage in light activities and gradually increase their movement. Strenuous activities and heavy lifting should be avoided for several weeks. Diet. A balanced diet rich in nutrients can aid in the healing process. Adequate hydration is also essential. Follow-up. Post-operative appointments with the surgeon are essential to monitor the healing process and address any concerns. Hormone replacement therapy. In cases where the ovaries are removed, hormone replacement therapy might be recommended to manage menopausal symptoms. Emotional well-being. It's important to address the emotional aspects of recovery, as some individuals might experience a range of emotions related to the removal of their reproductive organs. Resumption of sexual activity. Patients are typically advised to refrain from sexual activity for a certain period to allow for proper healing. Long-term effects. Depending on the type of hysterectomy and the patient's age, there might be changes in sexual function, hormonal balance, and overall health. Open communication with healthcare providers is crucial to manage these effects. In conclusion, a hysterectomy is a significant surgical procedure with different types and various indications. It can offer relief from a range of gynecological conditions, but it's important for patients to fully understand the implications of the surgery, including its potential impact on reproductive and overall health. A collaborative approach between patients and healthcare providers is vital in making informed decisions about hysterectomy and managing the recovery process effectively. Thanks for watching this video.